U.S. Health and Human Services Secretary Robert F. Kennedy Jr. is scrapping any future research and development of mRNA-based vaccines.
That's the technology used 5 years ago to develop every COVID-19 vaccine used to bring the pandemic under control, and which are still used today. Kennedy announced his department is cutting more than $500 million in vaccine development contracts related to COVID, bird flu, RSV, and other diseases. He says he believes the science behind mRNA is dangerous and poses more risk than benefits, in suggesting a move towards alternatives.
Right now, we're developing a universal vaccine at NIH, which is a vaccine that addresses the entire phylum of viruses. And so it's a vaccine that mimics natural immunity, and it is effective against any kind of mutation, so it doesn't drive the virus to mutate.
Many public health officials are criticizing Secretary Kennedy's move. And so is this man, Dr. Nirav Shah. He's the former director of the Maine CDC and former deputy director of the U.S. CDC.
He is now teaching at Colby College. Doctor, thanks so much for taking some time to join us.
Thank you so much for having me.
Let's start with the basics before we get to our first question. mRNA vaccines, we're kind of tapping into that old knowledge from the pandemic. What are they and how do they work?
mRNA vaccines differ from vaccines that many of us had because those older types of vaccines, they use a part or a fragment of the virus or bacteria that we're protecting against. They use that actual part of the virus, which gets injected and then helps our body's immune system mount a defense. mRNA vaccines take that one step further. Rather than using a particle of the virus or the bacteria, they actually use a snippet of the genetic code. Then our body sees that, it makes the protein, and then empowers our immune system to be ready to go against that virus after we see it. I know that sounds complicated, but the benefits of mRNA vaccines are a few. Number one, they can be changed a lot more quickly, as we saw during COVID. They can be updated on the fly. Number two, they're a lot easier to produce. Traditional vaccines, they require things like a lot of eggs, which come from chickens. And so that requires a lot more infrastructure. And number three, the possibilities with mRNA vaccines are things that we're just now beginning to understand. So when we think about being ready for the next pandemic, my view is that we need as many bets on the table, as many horses in the race as possible. Taking one of those sets of horses out of the race leaves us less safe, not more safe.
So Secretary Kennedy says he wants to go back to whole virus vaccines. What are they, and why have scientists moved away from them?
Whole virus vaccines are a technology that's been around for at least 50 years. They've had some challenges. They've had some safety concerns associated with whole virus vaccines. They are still in use to some degree, but not nearly as prominent as newer technologies, including mRNA vaccines. So the question on the table is, why hamstring a promising technology that's already shown its benefit, as we saw during Operation Warp Speed in the first Trump administration? Why take that off the table and rely on 50-year-old technology? You know, if we were talking about cancer drugs and we said, you know what, I don't like all these new therapies. Let's go back to the way that cancer was done and treated in 1975. People would be up in arms. But for some reason, that's the right move that the secretary thinks is right for vaccines. I think it's a wrong turn for us. Right now, in this moment, maybe whole vaccine viruses are the right way to go. Maybe they're not, but why not have all bets on the table?
It allows us to be more prepared for whatever the next pandemic might be that comes our way.
That's exactly right. I mean, preparation and preparedness is all about being ready for what's coming our way. The goal is to be prepared so we don't have to get prepared. One of the things we know about Maine and our performance during COVID is that preparedness matters here. So by taking mRNA vaccines off the table, it leaves not just people across the country, but including folks here in Maine, that much more vulnerable.
Dr. Nirav Shah joining us live in studio tonight for News Center Maine at 6. We really appreciate it. We'll catch up with you after the show, and we'll make sure that you can see all of the clips, including our live interview with Dr. Shah that happened at 5 o'clock.
Thank you
so much for being here.
Thank you.
Keith's forecast when we come right back.